As part of the Ministry of Health's push to increase COVID-19 testing in the hinterland communities, 20,000 antigen test kits were procured and are expected to arrive in Ghana later this week. This was revealed by Minister of Health Dr. Frank Anthony during Tuesday's COVID-19 update. He noted that both the PCR and antigen tests require the insertion of a nasal swab into the nostrils, except that with the antigen test, the results are presented within 45 minutes outside of a laboratory setting.
In this case, when you take the swab, you can perform the tests at the point where you're taking off the swab. And in some cases, these tests, depending on the type of test that you're using, they'll probably take about 20 minutes for you to do. In other cases, it might take a little bit longer. So what this helps us to do, it identifies the virus or fragments of the virus, and it allows us to get a better picture of what is happening with this patient rather than waiting for a 24-hour period, and then we'll get a result through PCR. So it gives us an immediate sense of whether this person has COVID or not.
He noted that while the new tests will allow health personnel to provide results in a timely manner, the testing services will also be available at the hospitals.
A lot of times the doctors are a little bit skeptical about admitting patients because they need to know their status. And when you wait 24 hours, you have to put the patients in a transition area and wait until you're certain from the PCR. This would reduce that time because we would be able to test people, and if they're determined to be positive, then we can immediately isolate them.
The ministry is aiming to conclude the requisite training of healthcare workers to administer the tests by Wednesday, after which the kits will be distributed to the various regions.
We have so far procured enough kits that can last us for maybe a 3 to 4 month period, and we'll see how it works.
There are now 3 COVID-19 testing options available in Ghana. The gold standard remains the polymerase chain reaction test, while the rapid antibody test is recommended as a screening mechanism. Temika Rodney reporting for the HGP Nightly News.